Yes. So, OTN, Once True Nature, was organized when?
Okay, What's Your Nature was established 2 years ago. Um, the efforts of our founding members. We have been preparing for this organization for almost 1 year. First, we did a problem tree why we need such an organization. There were three main problems we were able to identify. For example, the one is the that there are instances in the hospitals or in the healthcare profession wherein there is specific signs of stigma discrimination against based on gender and SOGIE. Number two, there have been identified health issues specific for SOGIE, and number three, we have identified the need for a community in the college, not just in the college but also in the University of the Philippines, Manila, to empower and to empower genders, SOGIE, and to involve the community in developing and raising such issues.
Was it difficult organizing the OTN?
Yes, it was difficult because medicine is a very conservative. It's a very conservative field. For example, although the UP College of Medicine has been very supportive, has been very open about it, there's several doctors who even part of the faculty who were quite surprised, didn't know how to react at first, and then but then we were able to explain and to make them appreciate of our existence. However, in the presence of such organization or in the not presence of it, there are still significant problems. There are still doctors who are not even who don't even know the difference between sex and gender, who don't even know what SOGIE means. So it technically says that there should be medical students or even medical professionals who are knowledgeable of such.
Okay. We're actually trying to deal with providing SOGIE information to students. But a lot of the problems of, for instance, the LGBT people have to do with the doctors who are now doctors, those who are practicing as doctors now, not just the students. Are we doing efforts to link up the lack as well? Because we're trying to basically remedy from the students' perspective pa lang. What about those who are already practicing?
Okay. So actually, sir, OTN is a very, it's a long, it's a very long, it has a good prognosis, and in such a way that we have established this organization not just to empower us in the stage in the stage of medical school, but for the rest of our future. Actually, one of the thrusts of our organization is to establish the values of an OTN doctor. So that is one, and second is, so far graduates of OTN, the OTN doctors now who actually there are only 4 of them. They continue to empower the advocacy and sharing to other doctors, other professionals, other healthcare providers that the importance of such issues. For example, we have our founding president is currently in Pangasinan, and he continuously shares about the importance of such issues and is continually involved with us. And as for those who are doctors right now, who are actually our problem, I think so far we've been trying to expand the value of the OTN doctor. For example, there are other medical schools who contact us and expressing the intent to establish such organization, so that they may also have the capacity and the opportunity to share or to show that it is such an important issue. We have been holding constant communications with our school administration and some of our professors in the UP College of Medicine Philippine General Hospital to discuss with them the issues of the community. So those are so far the small yet ambitious ways of trying to make them appreciate or trying to make them aware of the issues of the LGBT and the SOGIE community.
Okay. How big is OTN at the moment?
At the moment, we are only composed of 45 members.
Okay. For LGBT people in particular who continue to look at medical practitioners with suspicion, do you have a message?
For them. Okay. Sir, first of all, I don't want to blame them so much because it is only now that SOGIE have had so much progress in terms of its knowledge, in terms of its awareness about it, because it is only now that we have that it has become mainstreamed. I know it has been a very long journey for the LGBT community. It's been a very long fight for us, but it is only now that. But I guess this is what we enjoy right now. The efforts of our previous fighters, the previous hard work of the community. So that's one. Number two, I think, sir, for example, I had a professor in biochemistry wherein I expressed my intentions of doing transgender research about breast cancer and its risk for transgender patients who take hormones. What he kept on telling me was that, why do you have to study this, people? Why don't you just parang he said that it's a social issue, that we should not, and that in science we should not dwell with this kind of issues. I think that's otherwise. I think SOGIE issues are like any other issues in the world. I mean, it's important. It's really significant. So I think for these doctors, I think we have to give them time, because doctors because doctors are lifelong learners, and we have been taught that we should be open-minded of our patients, that our care should be patient-centered. So I'm quite hopeful. I'm quite optimistic about what the future holds for us, or what the possible changes in the attitudes of the medical doctors towards the SOGIE and LGBT community in the future. And I'm quite hopeful that in the future we would be able to expand the healthcare access of the LGBT community without discrimination, without stigma, and that we should all live life, or we should able to access healthcare without any discrimination.